So today we are going to talk about the superantigens, right? First of all, two examples of the type of superantigen. First, we have the staphylococcal toxic shock syndrome toxin, and the second example is of streptococcal erythrogenic exotoxins. So both these examples I mentioned here are a type of the superantigen. A little brief about the MSC class molecules. Here, suppose this is MSC1 molecule, MSC1, and here we have MSC2. Talking about the MSC1, here we have its alpha 1 domain, or you can call it alpha 1 chain. Here we have alpha 2, here we have alpha 3 domain, and here this one we have beta 2 chain or beta 2 microglobulin. Moving on to the MSC type 2, MSC2 type, here we have alpha 1 chain of the MSC2, here we have alpha 2 chain, and here we have beta 1, and here we have beta 2 chain. So moving on to the superantigen, first of all, what happens if in case of normal antigen? I'm not talking about the superantigen. The normal antigen is taken inside up into the antigen presenting cell, right? Antigen presenting cell process this antigen and is presented onto its surface through what? Through MSC class 2 molecule. So it is presented, antigen is first processed inside the antigen presenting cell and is presented on the surface of the antigen presenting cell so that it can be recognized by the T cell receptor, which is present on the surface of the T cell. This happens in case of normal antigen. But what happens in case of a superantigen? So suppose this is the antigen presenting cell, right? Here we have its MSC class 2 molecule, and here we suppose T cell, and here we have T cell receptor, and T cell, here we have T cell receptor alpha chain, and here we have beta chain, and subsequently suppose this is the alpha side chain of the MSC class 2 molecule. So superantigen is a type of antigen which does not require any antigenic processing. So superantigen does not require any antigenic processing. So if this is a superantigen, what it actually does is it attaches itself outside the antigen binding cleft. So this is a superantigen, so it binds outside the antigen binding cleft, that is it attaches on the alpha side chain of the MSC2 and beta chain on the side of beta chain of the T cell receptor, so causing massive T cell activation. It is said that a superantigen causes more than 20% activation of the T cell, and you know, when more number of T cells are activated, they cause release of the cytokines such as interleukin 1 is released, tumor necrotic factor is released. So all these cytokines leads to the systemic inflammatory response in the human body. So this is how a superantigen is different from normal antigen, as it does not require any antigenic processing and it binds actually outside the antigen binding cleft, causing greater number of T cell activation and greater number of cytokines release, leading to the severe inflammatory or systemic inflammatory response inside a patient body, inside our human body. So that's all about superantigen. Thank you for watching the video.